Assalamu alaikum, the communication day. First scenario, starting with patient name Mr. Badr, 60 years old. Your role, you are the medical doctor in the medical clinic. You will sit with Mrs. Shireen, the sister. 6 weeks ago, the scenario, 6 weeks ago, Mr. Badr presented with back pain. An initial MRI was performed showing vertebral change suggestive of discitis. A culture was sent to the lab and he was started on antibiotics for pursued infection. However, the culture result later showed no bacterial growth. At that time, the medical team recommended a CT-guided biopsy for further evaluation, but Mr. Badr declined the procedure. Recently, Mr. Badr's back pain worsened, prompting a repeat MRI. The imaging now reveals metastatic lesion in the same vertebrae that were initially affected. Given these findings, the treating team has advised a CT-guided biopsy and further imaging to identify the primary source of malignancy. So we can start if you're ready, Dr. Dalia and Dr.
Yes,
Tanvir.
okay.
Okay, here you go.
Hello.
Hello.
My name is Dr. Adam, one of the doctors in the medical clinic today. Am I taking to Miss Shireen, sister of Mr.
Yes,
Badr?
doctor. Yes, doctor.
Yes, Miss Shireen, we are here today to discuss something related to your brother condition. Is that okay with you?
It's okay.
Miss Shireen, can you tell me how much do you know about your brother's health condition?
Yes, doctor, you know that my brother suffering from back pain last 1 or 2 months back. So came to here and they did some test. And I don't know actually what happened. So now again that pain started too much. I want to know that what happened actually with my brother.
Okay, and do you have any expectation about what is going on?
No, I'm thinking that maybe simple muscle pain or something.
Yes, Miss Shireen, actually you are right. He was come with a back pain, and his investigation at first saw feature of inflammation on his backbone, and he was started on antibiotic for that infection, and we take some sample, but it revealed no growth. At that time, we advised for another images for the back, and it will help us to know more about his condition. Now we repeated the images again, but unfortunately, the result is not like what we hope.
What do you mean, doctor? This is not infection. What is this?
Yes, actually, it is showing that there is some feature of nasty growth on the backbone.
Nasty growth? What do you mean by nasty growth?
It's like an overgrowth on the backbone. I am so sorry to tell you that it's maybe a feature of a cancer.
That means you are treating this is cancer. So why you are not treating before? Because my brother came before. That time you are doing some test, and that time you give antibiotic. Now you are telling this is cancer. So why you not treat before?
Yes, actually, I am so sorry for this news today. I know it's very hard to hear that news today. Actually, Ms. Sherin, it was not appear in the previous images, and we advise to get more information about this disease to make another images, so it will help us to take a snip from this lesion in the backbone. Unfortunately, this was not done, and it will help us more to know the diagnosis. And for now, Ms. Shireen, what we need to do is to make another plan for images.
But doctor, before that, I want to know that why you not did before that.
Yes, it was planned by our team, but unfortunately, Mr. Badr declined the procedure.
Okay. But
Um,
any patient can feel like that, but you should do it by force. Any patient, maybe he afraid, that's why, but you should do it by force.
Actually, Ms. Shireen, the patient has full right to agree about the plan of management or refuse it. Are you following me, Ms. Shireen?
Yes, yes, I understand.
Yes. Actually, Ms. Shireen, now our plan is to do another images that we can take some snips from this lesion appear in the previous images to know what is the nature uh, of this lesion in the back.
Okay.
Is that okay with you?
Okay, I will discuss with my brother.
Yes, yes. Uh, okay. Do you have any concern, Ms. Shireen?
Yes, actually, I want to know that if this is cancer, how we'll treat this, and from where this cancer appear.
I can't hear you.
I want to know that if this is cancer, how we'll treat this, and from where this cancer came.
Yes, actually, we don't know from where this cancer came. That's why we need to do some more images to know where is the primary lesion for this cancer. And so Mr. Badr will be treated under a group of doctors, including the cancer doctor and this joint doctor and cancer nurse to follow his plan of management.
Okay.
Are you following me?
Yes, doctor.
Yes. And the images will help us to locate the primary lesion. Okay.
Okay.
Okay. Can I ask you, Mrs. Shireen, what is Mr. Badr is doing for a living?
He was working before as a teacher, but now retired.
Uh, okay. And is the symptoms affecting his social life now?
Yes, due to back pain, he cannot maintain his normal daily life.
Okay. Okay. I'm so sorry for that. We will try to help in this regard. Did Mr. Badr is he smoking?
Yes, occasionally he is looking.
Okay. I know smoking is very bad for health, so I advise him to stop smoking. And we refer to some occupational this smoking cessation clinic. Did he drink alcohol?
Under limit.
Okay. And is he financially supported?
Yes, we are supporting him.
Okay. Okay. Okay, Mr. Reen, I will give you some videos or leaflet and brochures to know more about these images, okay?
Okay, doctor.
Okay.
I just want to know that, doctor, that this is life-threatening condition.
Actually, if it's not known and if it's not treated, it is a life-threatening.
Okay.
Yes.
2 minutes left. Anything
Okay.
you want to ask Dr. Dania? Any
for that
No, no, don't
plan.
give this don't give any clue, please. Dr.
Any
Wasim.
clue? Yeah, but because she's
No, no,
quiet,
no.
I'm trying
Yes, yes,
to. Okay,
yes.
go ahead, Dr. Tanvir. Yeah, you can ask.
Yes. Actually, if we will discuss. You said we will discuss with Mr. Badr. If he agree for the procedure, maybe he need to sign some paper, including all information about this procedure. Is that okay with you?
Okay, doctor, I will talk with my brother.
Yes. Yeah, I don't know about. Yeah.
Yes. Okay. It seems you finished, right? You want to do something else before 1 minute left?
No.
You can summarize, or you can ask
Yes.
summarization.
Okay. So, Shirin, can you tell me what you get from our meeting today?
Yes, doctor, I understand that my brother before came here with the infection type of issue for the back pain, and you are treating for infection. Later, you said that is not infection. Now you are thinking this is as a cancer, and maybe also it associated with other side cancer. So you want to now investigate that, and you want to treat this.
Yes.
Okay, time is up. Thank you, Dr. Daria.
Yeah.
Well done. Why you are quiet?
Actually, I don't know this is need contrast or no need for contrast for this procedure. That's the problem.
Okay, so Dr.
Yeah.
Tanvir will comment, then I will comment
Yes,
after.
I have
Okay.
multiple comments for Dr.
Yeah,
Daria.
go ahead.
Please,
Yeah.
please don't mind. Please don't mind
No,
because I am
no
not
problem because we
everything.
are here. Yeah, for
Yes.
teaching. No problem.
Okay.
Yes.
Yes, exactly.
Okay.
Yes.
Okay. First of all, that you give your introduction nicely, but you are not asking that I am next to the king or not. This is very important
Uh,
thing. You should
yes.
not discuss this is something confidential issue. You should not discuss not with anybody. A special person, you need to ask, I am next to the king or
Yes,
not. This is first
exactly.
thing.
Mm.
Second thing is you did not ask me, did you take the permission from your brother that I will talk with your health condition? So you
Perfect.
also not ask me permission because I make a note what are the point. Second,
Mm.
third thing, after that, after introduction, you started nicely. Then you explained me that my brother came here with back pain. You are thinking before like as a infection, inflammation. So you used some jargon. I mean, inflammation. It's supposed to be its illness. Okay,
Oh,
it's a
okay.
not
Yes.
inflammation. Inflammation is a jargon. Then
Yes.
you said that we give some antibiotic, but here actually not mentioned that antibiotic given or not. There they said they initially thought that it's a dystitis, but
It's
later
written given. Given.
I think antibiotic not mentioned here about the antibiotic. It's in the scenario not mentioned antibiotic. They thought
Mention.
that it's a
No, it's
Mentioned,
antibiotic
mentioned,
mentioned.
it's
Mention.
mentioned.
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 He was
Yeah,
started
yeah,
on
yeah. It's
antibiotic
written,
for
Okay,
that.
okay,
started on
okay, okay,
antibiotic.
okay, okay,
Yeah,
okay. Sorry.
no
Yes,
problem. No
antibiotic
worries.
Yeah.
mentioned. Okay.
Yeah, yeah.
Okay, that bug killing agent, but later you found it's a not infection. Okay. Then in the
What?
between when
I didn't
yes,
hear your last
then
point.
no. You said yes. Antibiotic
Oh.
given, but it's later found it's not infection. Okay. Then in the
Mm.
between when you are talking, you are not like concerning that I am with you or not, because when you are talking, you should in the break you ask, "Are you with me? Are you getting my point?" You have to sometimes knock that I am connecting with you or not. So this is one
Mm.
important point, and sometimes you are like as Dr. Basim said, for giving long time pause. Like I think that maybe you are thinking. So this is actually when you make the pause, it will show that you have lacking of confidence and you are going out of track.
Yes.
So
Yeah.
better to make as the fluent. Something you should talk. The 10 minute you should talk something. Okay, not make
Mm-hmm.
a silence or pause. And you did nicely silence and warning shot. I mean, golden silence warning shot during the breaking bad news. You did it nicely. And after that, yes, I actually want to know one thing, that why you not did it. And you nicely answered yes, he is actually competent and it's his right to take decision about his condition. That's why we did not force him. So you
Yeah.
answered this question very nicely. And another jargon you used, lesion. Lesion is a jargon, so you can tell that from the nasty growth
Uh,
instead of lesion. Okay. And
what?
then, yes, yes, tell
Yeah.
me.
What is the last
Yes.
point? I didn't hear you. What is
You
the
said
jargon?
lesion. I
Lesion,
mean that
Lesion.
lesion.
growth.
Yeah,
Lesion.
yeah.
Okay. Okay.
Because I said nasty growth and you said that you didn't understand what is nasty growth. I think for cancer we say nasty
Yeah,
growth.
I prefer to say cancer directly. Don't use
Yeah,
other
yes.
words. Better to say
And
cancer. Yeah.
okay.
Mm.
Then regarding that primary source, actually, you did not tell me, because this is one agenda that we will take the snip to identify of that nasty growth. I mean, it's cancer or not. And at the same time, we need to know that from where this originated, because this is your agenda. But you
Yeah.
don't tell me about the primary source. I asked you that from where it came. When I asked you, that time you answered that. Okay.
Mm.
And
Mm-hmm.
another important things, the main important things, I think Dr. Basim tried to help you, that you did not tell about the procedure,
Yes,
because
exactly.
you are going
Yes.
for one procedure. So what is this procedure? So you have to
Yes,
tell, yes, this is a one type of the simple procedure. Like first of all, if your brother agree, first of all, that we need
yes,
to keep him there, our special room for split taking room. We will do some basic blood test to see that he's fit or not. After that, we will make a nice dressing in his bag. We will introduce a fine needle under the image guide by numbing agent, so he will not feel the pain. And after that, we again close it by nicely dressing, and we'll keep him observation. And when he is feeling better, after that we can discharge him. So for these things, actually, we need to discuss your brother, and if he is agree, he will. We need a signed consent that he is agree. So you need to tell about that procedure. So last 1 minute you are, I think, silent. So that time you can use this
yes.
procedure.
Agree
Okay,
Yeah.
100%. Yes.
Yeah.
that's all. So your communication, there is some, as I mentioned, some point. You said me about good clinical judgment. I mean, how to treat. You answer tell this nicely. You take a good history from my social, my brother's social, and regarding that, you give also leaflet brochure, and you ask me again recap what I understand, what I know, and what the other point I mentioned as already. Thank you, Dr. Daria.
Okay. Thank you so much, doctor.
Thank you, Dr. Tanvir.
Yeah.
Well done, Dr. Dalia. I wanted to add only one comment. Feeling sorry for once is enough for the whole scenario. You didn't feel sorry for once, even. Supposed to be sorry for his suffering, for what happened. There is some misunderstanding in the scenario, not the scenario, the situation. He
Yeah.
denied the procedure, then this procedure delayed the diagnosis, and he came now with worsen. You didn't do any sympathy or empathy to the sister for his suffering. He came now with severe back pain. You can
Yeah.
ask even at the beginning, how is he now? I know it's quite distressing for him to suffer all this time after she expressed for you what she knows. I mean the background. At least give him or give her some feeling of sorry. Of course, no error at all in this scenario. No one will apologize at all because he
Yeah.
is the one denied the procedure. And this thing delayed the diagnosis. Add to all Dr. Tanvir points, this only missing point, you didn't do it perfectly, and you have to learn how to be sorry from your deeply heart. It is painful to delay a diagnosis and he will come with deterioration. It's difficult. So please be sorry and try to understand, try to communicate, I mean, to check her understanding. Anything missing? Do you have any concern? I don't know why you kept quiet. You have 2 minutes. You can at least, don't explain the whole procedure. You can offer here, we have a procedure. We can talk to your brother to explain to him this procedure, and if he's agree, we will proceed for that
مثلا عليك
with
لما
it.
تتجاري ليه اقعد رايق يا ولدي.
Sorry. Okay. So we can sit with him, secure a consent, and we will explain the procedure. If you don't want to explain, of course, this is not her decision, but at
Yeah.
least you give her some hint about the procedure. That's why I ask you what you want to do, Dr. Dalia. Anything missing?
Yeah. Yes.
Yeah. Plus, as Dr. Azhar said at the end, just check her understanding what she got from the meeting. Okay. This how to fill the gap and how to fill the time if you are feeling something is missing or you don't have points to talk about. You can fill the time with either recapping or something. It might help you like social, like occupational. Even here, occupational. What's his job? Does he need any support as his life? Who's with whom he's living? Anyone need his support? You didn't ask all these
Yeah.
things. You have
Hey,
to.
ask her.
No. She asked me that what is my job financially. I
Yeah,
am
yeah,
okay.
but
Like that. She
Yeah.
asked.
who's living with him? You didn't ask with whom he's living.
Yes, yes,
You should ask
yes,
Yes.
who's
yes.
dependent.
Mm.
He's the one responsible for a family, for example. So who's dependent on him? This patient maybe after a couple of weeks he be received either chemotherapy, radiotherapy. You don't know what's the plan, and you don't know what the origin of the cancer. It's something advanced. Of course, it could be advanced because it's metastatic, but we don't know the origin. We don't know what
Yeah.
the further plan and how he will suffer later on. Who who is dependent on him and what support they need at home. Okay, these point how to fill it and how to fill your time if you don't find anything to talk about. But Dr. Tanvir, although he doesn't know the scenario, I guess he didn't practice it before, but he was very nice surrogate. He give you a certain concern and you address the whole concern well, but I wanted from you to explain or to talk about the procedure itself, because this is the main task in this time and the previous time. Okay, suppose this patient, if
Yeah.
come earlier, the procedure will be the one to be explained. You have to tell him we will numb the area, we will do snip. You didn't talk about it except after Dr. Azhar remind you. Okay.
Yeah.
So please be more confident. You sound like you are stressed or you are less confident. As Dr. Tanvir said, there is lack of confidence, Dr. Dalia. You have to be
Yeah.
more,
Actually, this is because
please.
my first time, so this is the problem.
It's,
Yeah.
believe me, the first time always the most difficult time, but after that you will be perfect. Okay, you will
Yeah.
get a lot of confidence after this practice. Also, when you do a
Yeah.
surrogate, the next scenario will be a surrogate, and inshallah, hopefully, the next scenarios you will be more confident than this. Okay, but anyway, as a
Yeah.
first time, it's perfect. Thank you, Dr. Dalia.
Thank you.
I have another one comment. Like,
Yeah, go
see,
ahead.
this in my exam when I appeared in the
Yeah,
last
yeah.
time, I got GBS scenario, GBS, Guillain-Barré
Yeah,
syndrome,
Guillain-Barré syndrome,
and I
yes.
I also finished within 8 or 8.5 minutes.
Uh-huh.
Okay, but
Yeah.
I try to continue this by something because I'm
Yeah.
thinking that if I not talk, it will be as a negative marking will come.
Yes, exactly. Yes.
So what happened? Even examiner asked me that you have still 1.5 minute remaining. You want to do something? So that time I
Mhm.
am just rapidly thinking what I will ask because
Uh-huh.
I need to ask something safe, something because I should
Yeah.
not ask something out of track. If I
Yes,
ask something
exactly.
out of track, it will make another problem. So what
Exactly.
I did, I asked
Yeah.
again the patient, do you have any other concern?
Mm-hmm.
So actually, you asked me only one time concern, Dr. Dalia. So if
Yeah.
you have time, better to you ask something that do you have any other more concern? Because I am from my side asking, yes, doctor, this, but you are not asking me enough. I am telling from
Yes.
my side. So
Yes.
you have to ask, especially when you have time, you can recap, you
Exactly.
can search, is there anything gap? You can ask that anything you want to know more, anything you're thinking that I am missing. Just I want to mean that you have to fill that gap, not make a
Exactly.
silence.
Yes.
Yes. Okay.
Okay, thank you, Dr. Tanvir. Well done. Let's move to the next scenario. I will read it. Then I will read the comment because I can see a lot of comments. Thank you for commenting. Let's read the scenario. Is it there in the chat box? You can see it.
Dr.
Or
Basil?
yes. Hello, Dr. Dalia. Yes.
No, this is Dr. Salma. What if,
Dr. Salma, sorry, your sound very similar to Dr. Dalia. Go ahead. Yes.
because he is my friend, what if,
Subhanallah.
okay, what if
Okay.
the surrogate asks her,
Uh-huh.
is this disease curable? Is this cancer curable?
Yes.
Is this
So
any
tell
way
me
to
what
cure
how you
this
can answer
cancer?
it. Yeah, you answer it.
Yeah,
This one. You answer.
yeah. Yeah, okay. So, in order not to let the patient ask this question, she should explain because this is breaking bad news. So, breaking bad
Mm-hmm.
news, we should explain the news that we are breaking.
Yeah.
So, the scenario is telling that this cancer may be metastasis from another primary because usually when we have
So
bone
you will mention metastasis. You will say like metastasis.
no, not this word.
Yeah.
Uh, yeah, in usually
Mm-hmm.
in our practice, the bone cancer is the type of cancer which is spread from another primary
Perfect.
cancer. So
Yeah.
we need to do this
Exactly.
image and then
Yes.
explain the taking step with guiding to confirm our the suspicion of the nasty
Yes.
growth and to do other series of images to search for the
Exactly.
primary.
Yes.
Uh, when it comes to this question and the surrogate ask, is it curable?
Yeah. Okay.
So as we discussed, we are suspecting that this is a spread of a primary lesion.
Perfect.
If
Yes.
this is the situation, then I'm sorry to tell you it will be advanced and it will be difficult
Exactly.
to cure.
Perfect.
So we don't know yet. We need to do this further investigation. We
Mm.
test and images, and the MDT will sit with you and tell you about the situation at the time. I'm so sorry to tell you that, and I am feeling your suffer. And feel
Yes,
I can
exactly.
see that you are suffering. I can see that this is bad news for you. But
Mhm.
let us just wait for the test, and we will set another appointment and discuss again. Just
Perfect. Perfect. Yes. But don't say me
I don't
MDT.
know.
Group of doctors. Yes, yes. What you did
Yeah, group of specialists. Yeah,
is perfect. Yeah,
group
group
of
of doctors
specialists.
or specialists or perfect
Yeah.
what you did because you don't know or even in scenario written, we don't know. We are trying to know from where
To
and
know.
what the
Yeah,
stage. Yes, exactly. However,
yeah.
it's
Because
as you
I'm
said.
I am feeling Dr. Dalia is afraid to mention some truth.
Yes, no need to
Uh,
mention.
like like she's going around the word cancer, although
No,
she
no,
should.
it's possibility,
Everybody
by the
knows the
way.
cancer. Yeah,
Yes,
everyone know the cancer. Everyone know the truth. So we should discuss frankly about
clearly.
everything
Yes, yes,
clearly.
clearly
Yeah.
and frankly say it. It's possibility of a cancer. This is what is written in the scenario. And
Yeah.
a
Yes.
possibility, yes.
Cancer is not a jargon
No, no,
for the
no, no, no,
exam.
no, not a jargon at all. Cancer, everyone, even
If you
Arabic
want to
speaker,
protect yourself,
cancer.
say both.
No, no,
Say both. It's a
no,
nasty
no,
gross. I mean by
no, no, no.
that
I
cancer.
prefer to say
Both.
cancer. Don't say Nestigor.
Yeah, but
Cancer
cancer
is
is
a
well
cancer.
known.
Even
Yeah.
our culture here, if you say cancer, they know it. Even the Arabic culture, cancer is a cancer. No, for everyone, cancer is a cancer. It's easy and
Yeah.
simple word. No need for Nestigor. I don't prefer to say Nestigor. I think cancer is fair enough to say it, and you can say, I am sorry, sadly, use some sympathy and empathy to explain this is not only cancer, it's also spreading from certain areas.
Yeah.
Yeah,
Yeah, this
as
is my
and we call
point,
it,
actually.
yeah,
You
we can
understand
call
me
it
very well.
metastasis.
Thank you.
Yeah, and
Yeah.
this spreading make the cancer is an advanced stage. We don't know
Advanced
yet
stage.
from where the origin or the primary
Yeah.
cancer. However, we are here to do that, either by SNP
Yeah.
or doing some imaging to confirm where is the primary cancer and what the nature
And
of this cancer.
do it early. Yani this
Yes, it will be
information
as soon
is
as
very
possible, of course.
important to do it
Yes,
early. As soon as you break the news that
exactly.
we did the image, and the image showed that there is an osteoporosis, a cancer, as you want to say, but better to say cancer.
Mhm.
As soon immediately you explain that in our practice, usually the bone cancer in this area is usually a spread from another primary lesion, like the
Exactly.
scenario
Yes.
said. So
Yeah.
Exactly.
we
Yes.
need to search
And
for the primary. Yeah, let
perfect.
the situation very clear for her. This is very
Cle
important.
Perfect.
Yeah,
And don't try to add from your side. It might be from prostate as he is male and the most common cancer spreading to the bone is the prostate. No, don't add or don't invent. Any point
Yeah.
you will be
yeah,
inventing, it will harm your mark. So yeah, it's common to be prostatic. It's common to be a bladder, whatever the origin. Don't start to mention it or even to think about that. Okay, what's
yeah,
written,
Mhm.
follow and stick to the scenario.
yeah. If you want
Okay?
to fill the gap in the end also, do you have any concern for me?
Yes, exactly.
If
Yes.
she said yes, you answer concern. If she said no, then you tell her, so again, I am so sorry for what happened. Or you can skip sorry or say, you make sure that we are here to support you and support your brother. And I'm
Mhm.
going to give you some leaflets and brochures to read more about this possibilities of cancer in the bone and about this image that I explained to you now, and to know more about this procedure. Fill the gap with these things. More
Exactly.
support, more, yeah.
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 If someone want to ask also about the point of palliative, what we are mentioning equal to palliative. We will sit with a group of doctors, the nurse, also specialized nurse. We can say this is Macmillan nurse, the specialized nurse for cancer, and we will do our best. But no need to mention palliative here as it's not a task. This is what
Actually,
I
it's not
prefer also.
confirm diagnosis يعني لسه
Exactly, it's
not
exactly. But
confirmed.
if advanced and metastatic, yeah, some
Sebastian,
doctors will
that
ask as the
remind us
previous.
with
Yes, the previous
with the
discussion.
scenario
Again,
before, yeah.
yeah,
Oh, yeah.
again, I'm saying it. No need to mention it
Uncertain
as a word,
diagnosis,
but you
yeah.
can mention it as a description. A group of doctors will sit with him to
Mm.
address this cancer, how to be treated. Is it something to be cured? We will try our best to support him in this journey. It's difficult one, and we know that he will suffer, and we'll try to make him free of pain. This is the most common presentation of this type of cancer, especially this patient already present with pain. So the most important to keep him pain free. And this is the main also job of the palliative team to keep the patient symptom free or pain free. It's not as a palliative by the word, but it's a palliative by the definition. Okay, let's be agree for this. No need to mention palliative, but you can say what the palliative team doing. Okay, clear?
Mhm.
Clear for all?
Yes.
Okay, let's read the scenario for Dr. Tanvir before receiving other comments. Patient Mr. Khalid, 55 years old. You are the senior house officer in the dermatology clinic. Mr. Khalid present to the hospital with a suspicious lesion in his left hand. It was partially resected, and the diagnosis of malignant melanoma was confirmed 4 months ago. Mr. Khalid was not told about the diagnosis at that time. Now he present to the hospital, and after assessment, it was found that the melanoma had spread locally, and the team decided the need to amputate the left hand. Your task: discuss the situation with Mr. Khalid, explain the need for amputation, and address any concern he might have. If you're ready, Dr. Tanvir, we can start, or
Okay,
you can
we
read.
can start. No, we can
Okay,
start.
so we can postpone the any question before moving to the next scenario from others, please.
Assalamu
I will
alaikum.
try. Walaikum salam. Yes, I guess Dr. Muhammad, right?
I want to ask about
Dr. Ibrahim.
Yes, Dr. Bahman. I want to ask about is it always we should ask about alcohol and smoking? I think here it's not relevant
It's
scenario.
if you don't have time, you can skip it. I believe if Dr. Dalia speak about the procedure, she will not speak about alcohol and smoking. I agree with you. So it's not necessarily rather than explaining the procedure. So if you want to give priority for the procedure, not for the alcohol and the smoking. Okay. Perfect. Thank you, Dr. Ibrahim. I
Yeah.
agree for that. But if you have time, it's okay. You can ask it, and let us say it in another way. We will sit with Mr. X and explain that the harm of this on his health, not to his sister, because the sister will not do anything, right? This is our decision to sit with him and to refer him or to address or to treat or not. You want to know it, but don't address it with his sister. You will know it, and we will sit with Mr. X to address this concern with him. We can refer him to specialized team to help him to quit all these things because it harm his health. That's it.
Sorry.
Again, after
Also,
finishing the procedure.
Dr. Bassem,
Yes.
how
Yeah,
are
yeah.
you?
Hi.
Fine, alhamdulillah. Look,
Dr. Bassem, I have a question.
yeah,
Uh,
Dr. Muhammad.
what could be the
Thank
benefit
you.
of biopsy in this metastatic lesion or supposed to be a metastatic tumor?
It's not our task. Sorry, it's not our job here. This is the task, right?
Uh-huh.
This is the task. We are following the task. Whatever
Uh-huh.
they wrote, we are following. What
Uh-huh.
is the benefit? This is not our job or our concern. They wrote from us or they wrote to us to take a snip and to explain it. So we have to address it and to explain it. What it will help, what it will add, what it will do, this is not our concern because the scenario asks you to perform it. But yes, scientifically, yes, what the benefit? I should do CT cap, for example, or to search for the primary rather than taking from the back itself. But this is not at all our task. Our task is to perform what the scenario wrote. So written
I
as a
have a
procedure, you
comment
have to.
regarding
Yeah,
that.
yeah, go. Yes, Dr.
Yes,
Thank you.
Tanvir, go ahead.
what Dr. Ahmed said, yes, I just give the answer because it's still not proved. This is as a cancer. This is a suspected. So we need to do biopsy to prove this is a cancer. And after that, we need to see that from where it's originated. I mean, primary root. So yes, of course,
Yeah,
Dr. Basimot said, this is our role. What is the agenda giving? We have to tell
yes,
like
yeah,
that way.
exactly.
But if you want to know that what is the why we need to do biopsy, yes, because we need to be sure because it's not infection. So we need to be
Mhm.
confirmed by biopsy. It's a which type of the cancer, what is the its grading like that. And we need
Yes,
to
exactly.
also at the same time we need to search that what is the primary origin.
Mhm.
Thank you, Dr. Tanvir, Dr. Bassem. Thank you so
Thank
much.
you, Dr. Muhammad. Thank you
Excuse
for your
me.
questions. Yes, go
Hello,
ahead.
everyone.
Yeah,
Assalamu
Dr.
alaikum.
Dalia. Alaikum salam.
Um, hello.
Yeah, yeah, we can hear you, but I think also there is another one talking, but we cannot hear you, Dr. iPhone. We cannot hear you. There is breaking in your sound.
If Dr. Aishan close her mic, maybe we can hear better.
Okay, go ahead, Dr. Dalia.
Assalamu alaikum, everyone. Just I
Alaikum
want
salam.
to when I just read the scenario that very important to be accurate and precise. That it's written here, and the imaging now reveals metastatic lesion in the same vertebrae. So it's not written. It's a possibility. Okay, so I and I this is not to, and it's mentioned there. It's need to be to know advice to CT biopsy for further imaging to identify the primary. Okay, not to prove that it's cancer or not. To make sure it's cancer or not cancer. It's cancer. It's revealed because by MRI the criteria of spread it's fulfilled, and they could say confidently this is a metastatic cancer. Okay, so if they mention that on the report, I can't change the language. I can't say this is a possibility. I can't say this is we need to do to know it's the benefit of this test is to know it is cancer or not, or to prove it's cancer. Yes, it's okay. This is a confirmation test that what we are seeing on the MRI, it's a cancer, and we need to confirm that by biopsy. Okay, so it's better to avoid change the language. Okay, change to be, because this is one of the most important for the clinical judgment, and if you change the language it will put the consultant in a great, in a great pressure, or in a great in something. It's that could it could be false hope for the patient. It could be this is a cancer or not cancer, is a possibility or not possibility. It reveals, okay, the language here is revealed that is a cancer, and they want to know what the origin of the primary. So please just keep in this. And on the other hand, if we say that it's not our task, yes, I agree with you, Dr. Basim, that is not our task to yeah, just to mention that, or to offer what the benefit of this and this and this. But we might, the surrogate might hit me up by a concern. If you said it's advanced already, for example, just say I'm the surrogate and said, you've mentioned, doctor, that it's already it's spreading into the bone, and it's, you said it's advanced, so, and it's the outcome is poor. Why you put me under this investigation, to take a biopsy, and so and so and so? At this point, yes, the patient is right, and he has the full right to say, to share the management plan. So if if he feels that he needs to do the investigation, is his right, because it's already advanced, it's already metastasized. This is stage 4. Okay, so, and if he want to do the investigation to know the biopsy, okay. If not, just your job is to reflect that. And if he asks you why we want to do, if we know the primary, there is for the treatment of the symptoms, and to give you more time. For example, for palliative management, if we treat the patient with chemotherapy or radiotherapy as a part of prolongation of life, to just some extension of the life. Okay, and this is one of the advantage of to know the primary. Okay, so, and it depends, it might give the patient more time. There is some patient ask for any treatment just to prolong their life, to attend for example his son marriage, okay, his anything, anniversary, or they have sometimes, okay, an occasion they want to extend their life to attend that. Okay, so they could ask for that. So just be honest with them. And this is if we know the primary, it's your choice to do that. But with the benefit of that, if we know where the primary, and could know if we could give the cancer doctor could discuss that with you, if there is any possibility of any chemotherapy, or any radiation for that, or any kind of, but the intention is not to cure. Okay, yeah, to be, I don't know, but I've
Dr.
attended
Daria,
many occasions. Okay, I've
Dr.
attended many
Daria,
occasions, and such in such conversation. And I know many patients, they decided not to do the biopsy, because they say they don't want to have to get um, any chemotherapy or radiation, because the outcome is poor. Okay, so our job is not to push the patient to accept that. but to know the options, and the patient could decide to choose whatsoever suits him. I don't know if I make myself clear, but
Yeah,
this
clear, Dr. Dalia. Thank you.
okay.
Yes,
So please, 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 because this will affect your clinical judgment a lot if you
yes, I
the
agree.
language, and just prepare to any question. So every question is come from our colleagues here is really valuable. So it might hit up the anyone in the exams, and sensible question really. Thank you.
Yeah, thank you, Dr. Dalia. So again, it's written here in the scenario imaging now.
Just
To be
one thing, Dr.
mesenteric
Dalia,
regions.
when you
Yes. Yeah, go ahead, Dr. Salma.
yeah, when you said if the surrogate hit you with the question, why should I do the biopsy? Now that you know it's a spread, and just do the images and know the primary without doing this biopsy. So if I answered, thank you for raising this question. Your question is valid. We are going to do the biopsy because the result of the biopsy will affect our plan of management, and knowing the type of the cancer will depend on this biopsy also. Is this like this giving him hope, or this is a good answer? What do you think?
Um, um, if you want to say it's good, yeah, it's true, but
Mm-hmm,
to make sure he didn't get you wrong, just you
mm-hmm,
need to ask him, and you need to remind him that
mm-hmm.
doesn't mean that
It's
this
his
cancer
right.
is curable, by the
Yeah.
Mm,
way, but
So,
it will
Doctor,
mm,
give the cancer doctor what the option that might have if you would like to go for the palliative, what we call palliative treatment. It's a kind of
mm-hmm,
treat the cancer and to prolong the life and to give
mm-hmm.
more to improve the symptoms. Okay, for
Okay.
example, if in his back, okay, so they might
Mm-hmm,
get radiotherapy that will improve the pain, the symptom
mm-hmm,
that accompany that kind of
yes,
metastasis. Okay, so you will be clear with him. Okay, so
mm,
and I guess this kind of scenario, it's really breaking bad news, and
mm-hmm,
with reflection of that is poor outcome, despite there is many steps and how to this is the challenge here, how to explain and to
mm-hmm.
reflect what that is written in your task, how
yes.
Okay.
correctly and accurately describe
Mm-hmm,
the situation.
So,
Okay.
mm-hmm.
Dr. Dalia wanted to say, don't say possibility at all. It's a cancer and there is myths. This is the
Yeah,
aim.
it's reveal it's
Yeah,
Yeah,
we
this is the
counseling.
agreed
take-home
for
message.
this.
Yeah,
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 Okay.
yeah,
Dr. Basim,
yeah.
we agreed
Yes,
for
yes.
this. I told Dr. Dalia, who did the scenario, you should explain to the patient that this is a spread type of cancer, and we
Cancer,
need to
exactly.
search
Yes.
for the primary.
Without
I told
possibility.
her
Yeah,
this,
without
we
any
agreed
Yes.
for this.
possibility.
Yeah,
Yes,
yeah,
I
without any visibility. Yes, this
yes,
is very
yes.
clear in the
yes.
scenario.
Thank
But
you. Yes.
I was asking her how to answer if he said, and also I understand from her answer that we should not make the biopsy like a must
Yeah, yeah. Don't push. Don't
investigation
push.
for him. Don't
Yeah,
push.
don't
Yes,
push. Yeah, don't push. But
and yeah,
she has the right either to accept and not her brother.
or yeah,
He
accept
has
or
the right
refuse.
to
Yes,
accept
yeah.
or refuse,
Yeah.
and don't push.
Okay,
Although this is your
Yeah.
okay.
task, but she might or he might refuse, and it's okay if he refuse.
Or might accept. Yes, you
Yeah,
have to highlight
Okay.
clear.
this to the patient.
Yes,
Thank
Yeah.
you.
exactly.
Thank
Clear.
you.
Yeah.
Yeah,
Thank
and,
you,
Thank you
and
Dr.
so much.
Dalia.
nowadays
Yeah.
the trend, I guess, nowadays the trend is to give scenarios in such scenario, like it's mean that to share the plan of management with the patient and show him
Yes,
the
exactly.
possibility and
Yes, that
why,
is
Yes.
true.
and could
Yes.
share
Yes. Yes.
could share with you the decision what it's gonna do. Okay, so and before that, when we are just starting to prepare for the paces, I feel that I need to convince people with something, but this is not the true.
Yeah.
It's not true. So this is to just precipitate this idea, and
Mhm.
yeah, it's a share decision between the consultants and between the patient. They should
Yes.
know the possibilities, and they have the right to decide according to the clear information from our side.
Yeah, this is also what we are doing in real practice.
Yes.
We always be neutral, not pushing and not also convincing. We are trying, but he is sharing the decision with us, not by push.
Yeah.
Thank you, Dr. Dayan, for
Yeah.
clarification. Thank you so much.
Thank you.
Let's start with Tanvir, the next slide. You ready?
Okay.
Yeah. Here you go. Timer is ready now.
Let's start. Dr. Dalia, ready?
Yes.
Yeah, go ahead.
Yes. Okay. Hello, sir. I am Dr. Ali, one of the doctors in the 16th clinic today. Can I confirm you are Mr. Khalid, 55 years old?
Yes.
Mr. Khalid, today I came here to discuss regarding your health condition. It's okay for you.
Okay.
How are you now feeling?
What? I cannot hear you.
How are you now feeling? I mean, you are okay now?
Yes, doctor. Actually, I have now more lesion on my hand, on my, sorry, 1 minute. Sorry, doctor. I have more lesion on my hand, doctor. I don't know what is the problem.
Okay.
Yeah.
Okay, so Mr. Khalid, today I came here to discuss sharing regarding your skin condition. So do you want keep anybody in our meeting today to support you?
No, thank you.
Okay. Can you tell me more actually what you feel? I mean, what's your health condition now?
What?
Can you tell me more how much you know about your health condition?
As I told you, doctor, I don't know what happened. I have more lesion on my hand. Yeah.
I'm really sorry actually what happened with you. Can you tell me what's your expectation from our meeting today?
Actually, I don't have expectation, doctor. I just want to know what is the problem.
Okay,
Okay.
Mr. Khalid, yes, I understand. I'm really sorry to hear these things that you are suffering a lot. And if you permit me, so I can proceed. Is it okay for you?
Yes.
Okay. So as you know, Mr. Khalid, before you have in your left hand, there is a one type of the growth. We are suspecting something nasty growth. And due to that, we suspecting this is one type of the skin cancer. Do you aware about that thing?
No, actually, no. No one told me.
Okay, I'm really sorry. Actually, what happened with you is supposed to be inform you these things. It's your full right to know about your health condition. And I'm really sorry on behalf of our team. And we already reported it actually. We make incidents report. We already discussed with our
Doctor,
consultant.
you mean I have a cancer and you didn't inform me, doctor?
I'm really sorry, actually. As you know, that 4 months back, you came here with a nasty growth, and that time we suspected it as from your one type of that skin cancer, which is originated from some color producing cell. Are you aware about that before?
No, doctor.
Okay, so as far I know that nobody informed you. So it's I'm really sorry on behalf of our full team. Actually, it's your full right to know about your health condition, and we are give it special importance why actually not informed you, and we will investigate it. We make incidents report. We inform our consultant and also our risk reducing team. We arrange a meeting actually what happened, and maybe there is some miscommunication happened, that's why not informed you. So I just want to assure you we are taking proper action actually, why it's actually not informed you. Are you getting my point?
Doctor, this is not professional, and this is a big problem to know my diagnosis, and no one informed me about this diagnosis. Why that happened?
Yes, Mr. Khalid, I understand actually. I'm really feeling sorry for all of behalf of our team. Yes, you are fully right. Even if I am in your position, of course, I will be not feel okay if I heard like these things, because in this type of the situation, any patient has full right to know about his condition. So as I said you that we are taking all of measure that why actually not informed, and already we make the incidence report, and we already informed to our consultant and our risk relationship. So I just want to assure you we are taking full measure to know that why it's not informing. Are you with me?
Yes, doctor. Doctor, I want to complain that doctor who saw me 4 months ago.
Yes, I appreciate your concern. Actually, as you know that it's a full teamwork, like we are a group of the doctor. So actually nobody individually responsible for this type of the decision. It's our whole teamwork actually. Are you getting me?
Yes, doctor. But I want to
So,
complain that doctor also.
okay, so so if you want to complain, I can guide you to our patient advisory liaison committee. I can guide there, so you can make your complaint there. And I want to assure you that it will not affect your further treatment plan. Are you with me?
Yes, doctor.
So if you permit me, I can proceed from the next step. Is it okay?
Okay. Yes.
Okay, so actually, as you came here again and we assessed you further, and our actually assessment result, what we found actually it's not as good as we hoped.
What do you mean, doctor?
Actually, we found that that previous skin cancer, I mean, what I mentioned that from that color producing cell of your skin, actually this skin cancer spread it to your hand.
Okay.
So actually, I'm really sorry to tell you, and I'm feeling afraid to tell you that. So if this cancer, as you know that now the skin cancer is spread to your hand, and actually if it's spreading, so maybe it will involve not only your hand, it can involve your other parts of the body. It can spread to some of your other organ. So in that case, actually, our group of doctor, I mean our cancer doctor and our team decided actually to prevent the spread of cancer. Are you with me?
Yes, I'm with you. Yes.
So for the prevention of this cancer, I am feeling afraid to tell you that actually we need to remove the part of your hand. I mean, your left hand, actually, that part need to remove to prevent further prevention of cancer.
You will cut my hand, doctor? Oh my God.
Yes, I understand that it's very difficult to accept everybody this type of the things. But actually, in this situation, as I said you, that we already involved our cancer doctor, our special nurse, and also our group of the doctor to support you. And for the prevention, for the best interest of you, we need to actually remove that it will not spread other parts of your cancer. Because if it's spread to the other parts, it will be life-threatening. Are you getting my point?
Yes, doctor.
So before that, I want to ask you that actually what you are doing for living.
What?
What you are doing for living.
I am teacher.
Okay, how much it's affecting
2
your
minutes.
teaching life and daily life?
It affects me too much.
Okay, so we will involve our social care worker and our occupational health worker to support you. Is it okay for you?
Okay, doctor.
Okay, if you don't mind, can I ask that you smoke?
No, doctor.
Do you take alcohol?
No, doctor.
Okay, appreciated. So anybody there in your house to support you?
No, doctor.
Okay, so we'll arrange our session workout to help you, to support you. Is it okay for you?
Okay. Okay.
Do you have any other concern?
Yes, I just want to complain.
Okay, I'm appreciating, as I said you that I will refer to your patient advisory liaison committee. You can make your complaint there. Is it okay for you?
Okay, doctor.
I will give you some leaflet and brochure about that melanoma, and so you can read more about that. And I will give our contact number. And again, I want to tell you sorry from all of our behalf of the team. Actually, what the mistake happened, and I want to assure you, we will take kind of the precaution to not happen this type of the again. Do you have any more concern?
No, doctor.
Okay, thank you. So if there is a time, I will make a recap, but there is no time.
No. Time is up. Yeah. Dr. Dalia
When
can
is
comment now.
recap in
Yeah,
medical
better
error?
not to. Yeah, exactly.
Not
Don't recap. That's
No, what I told, just that thing I want to recap if I get the time.
yeah.
Okay, thank you.
okay, Dr. Dalia, you can comment.
Dr. Tanvir, you are very lucky. She is very benign. If it's me, I will tell you I am left-handed. I am a pianist. I want a compensation. I want a
Yes.
compensation.
But you know that Dr. Dalia thinking actually what is complaint. What her complaint, she is taking a time
Yeah,
to read the
and
scenario.
will
That is
cry.
killing my time.
You will need to give me tissue and water.
Yes, but sometimes it's kill.
Yes, other comment, Dr. Dalia? You have other comment?
No. Actually, but he need more sympathy and empathy for
Yeah,
this scenario. Yeah.
yeah, I agree. I think Dr. Tanvir
Up to
was
8 minutes, I give only empathy and sympathy up to 8 minutes.
and
Last,
apologize, but
And
let's
apologize also, yes.
yeah, he apologized.
Not just zero, yeah, and yeah.
But I
And
prefer also Dr. Tanvir to speak about the medical correction or the medical point. What you will do. Now there
Yes,
is a mistake, yes.
I think artificial hands is important here, or what? How to compensate this loss of our hand?
artificial
I,
hand, yes, that is important part, yes. We can arrange from optometry doctor there's artificial,
I
but
think
actually supposed to be patient, it's a patient
occupational,
concern. Like, no,
yeah,
if patient
occupational
asks that
therapist.
if I lost my hand, how will I work? So that time I think I can tell more about that we can
But
arrange with our optometry doctor for
I
artificial
think this
hands.
is
Dr.
occupational
Tanvir,
therapist.
when he
Yes.
started the scenario, he asked the patient, are you aware about that? I don't know if he's allowed to ask the patient or just break the news because the scenario told him that the patient is not aware already. I don't know
Yeah,
if
yeah.
No,
But it's okay to confirm.
aware I means that she know about her health condition. I mean, he know his about health condition. Aware means that aware, not about that not
uh,
informed.
Yeah,
but
even
okay.
you can confirm it.
didn't know. You should tell him that he's not. We know diagnosis and we will not inform you.
No,
Like that.
don't say that. No.
No,
Listen,
it's I should not.
yeah.
I should not tell. It's
Because
a patient will tell.
this is a
Yes,
because
this
this
is
is a
what,
mistake.
of course,
Please,
this is a
please.
mistake. He will say it. He will say it to you.
Yeah,
Why you want to tell him?
word by word, explain this to us clearly. Should we ask him, are you aware that at that time the team was suspecting that you have cancer? Or should I break to him? I'm so sorry. At that time, the team know about the diagnosis, and unfortunately, it is unforgivable. It is a mistake. They did not tell you what is right,
The
this or
best
this.
way, the best way is to listen from him. What's his background?
Yeah,
I
he
had
listened to from her. She did not mention that they told her that it is a cancer. She just
don't
said, "I
know.
came
She
here."
don't
She
know.
don't know.
Yes.
She don't
Yes.
know.
okay. So
So
you will
should I
admit,
break
yeah,
or
yeah.
ask?
You will break and admit it was a
Yes.
cancer, and
Yes.
I'm so sorry to say it was an error from our side, and this is your right to know it since the beginning. I'm so sorry for
Yeah.
that, and continue your apology and the all steps of medical error, because this is the duty
Okay.
of candor. Okay.
Yeah, I agree with that.
Yes.
Could I
And don't
add?
try to hide. Yes, Dr. Dalia. I will add this on point only. Don't try to hide by any way or by any mean. Like, if he didn't talk, I will not say it. No. You have to be honest from the start. Acknowledge, admit, and apologize. Okay? Yeah, Dr. Dalia, you can comment.
Yes, I agree with you, Dr. Basim. It's let the surrogate just drive the scenario. Okay, so from the start, could I know how much do you know about your condition? Then he will say that my condition is started blah blah blah, and then he said that there he will show his knowledge about that, and you could detect which is his information. What's his information? Okay, if he said I
Exactly.
know this is a cancer, and that I know this is a cancer and excised it, and now
Yes,
it's recur again, okay, he knows. But if he said there
I
was a
don't know.
lesion, I'm not sure what that. Okay, okay. Then at this, you need to ask him what and what the diagnosis that you think it was. Yeah, that just drain the information and and see if this patient has any, because if you want to break bad news, you need to know if he put this possibility of a cancer or no
Yes,
at all. If it will be, you need more pauses to do the
exactly.
breaking bad news to him.
Yes,
If it's he has the possibility, but he no one confirmed the possibility for him. So I'm sorry, you are right. You're just your thoughts were right. It's a cancer, what is called melanoma, cancer of skin, and it's called melanoma. I'm sorry, and then blah 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 blah. And
mhm,
after you explain the disease, you just do the medical error steps. You need to apologize for that and to do the rest of the scenario. And in this scenario, particularly this scenario, it's need to be clear that the medical plan, you have legal plan and medical
exactly.
plan.
Yes,
The medical
yes.
plan here is a surgical plan.
Surgical plan. Yes, exactly.
Okay, that's thank you.
Yeah. Yes, thank you, Dr. Dalia. So again, try to mention the medical plan before the legal plan. The medical plan, we immediately call the doctors responsible for this type of cancer, and they will deal with the cancer. I'm so sorry, it might reach to the extent of amputation. Means amputation, by the way, also jargon, right, Dr. Dalia? So better to explain it in a simple way. Sorry to say, it might cut your hand to remove this nasty growth or this cancer in order to prevent extension or spreading of this cancer, because it's a kind of advanced cancer which is aggressive one. It might spread to other area in your body. So in the best interest for you, the team decided to cut your, I'm so sorry to say, to cut your hand. Be sorry always whenever you say this, because it's so hard to mention cutting or amputation to patients. Believe me, it's very difficult decision in his life ever. Even it's infected. Some patients, the elderly especially and particularly, the elderly patient, they will tell you, no need. I will let it like this. I will die with it. I don't want to touch me. No blade will touch me. I don't want anyone to touch my skin. So it's very difficult to mention it. It's not easy to say, we will cut your hand. This is our decision. No, be very sympathetic and empathetic in this type of information or decision. Don't say it like easily. Be also decrease the tone. because it's a very difficult decision to do. Okay. Anything else, Dr. Dalia, you want to add? Yes.
There is a problem with
yeah.
autonomy in this patient. We have to highlight that patient should know anything about his disease and plan of management, and this is error in his autonomy because they didn't inform him.
Yes, exactly. This scenario depend on the action on as the medical error acknowledge. So you will do all the steps of medical error, but please always start with the medical plan. We immediately call the doctors responsible for that. They will take an action, and the action might be like this. Plus, in addition to that, we had another action, which is, as Dr. Tanvir said, the legal issue. Insert report. Exactly. This is the way how to do. I think the best and the easiest scenario in PACES ever is the medical error. You can fill the time.
Straightforward. Yes.
Yes. All steps you can do it in the 10 minutes, and you will not be silent for a single moment. This is different than other scenario with uncertainty and so on. Yes.
Dr. Basim,
Yes,
I want to just to say the amputation in different way. It's you need to say the surgical removal of the plan is to do an amputation. Don't bother yourself by this name, but amputation that's mean to remove the part of the body by surgery. Okay, so it's mentioned that the hand and the surgeon could let you know the details of the surgery, but here just the idea, that is surgical removal of part of the body, and in your
you
case
mean
it's
easier than cutting. Okay.
Yeah, cut means it's only cut, like incision.
Okay.
It's like a remove.
Remove,
Like,
it's removal
from your hand.
yes.
Yes.
So
and
if you say
very
cut,
important.
he will understand that is incision.
Yes, agree. Yes, agree.
Okay.
And important.
And the other thing I would like to just in this case, to play with language, okay, and that it's I have bad news for you today, and said they will just prepare him for something very bad. This is a cancer of the hand, and now it's recur in your in your hand again, and it's now spread it in this area again, the origin or anything you could say. But the good thing is that it's so far it's not spread it anywhere far. So that's mean still we have space for cure.
Yes.
Okay. So if you say that in any simple language, so you give him that you reflect that it's recurrence of the cancer, and the same times it's not a poor
Curable.
outcome.
Yes.
Okay. So and
it is not recurrent, doctor. It is not recurrent cancer.
It's not
the same
recurrent.
Cancer is spreading. Yes, same cancer is spreading.
It's spreading. Okay. So it's not recurrence. Okay. It is spread locally. So they didn't excise the whole cancer. Yeah. Okay.
Yeah, it is spread locally. Yes.
Actually, Daria, it is breaking two news. Again, I insisted on this topic especially. In the beginning, you will ask the patient about his thoughts.
He doesn't know.
He will tell you about his thoughts that it was a lesion and excised. He don't know anything. So I'm sorry to tell you, I have bad news today for you. Pause, and then that time when you presented, the team was thinking that it is a cancer, and actually they excised it partially, I think, right? Partially.
Yes.
Resected. So this is the very bad news. So the team suspected of this, it is malignant, and it was resected partially. And unfortunately, this is an unforgivable mistake. Here, you should admit the mistake. I think. Correct me if I am wrong.
Yes. Go ahead.
Because at that time, They suspect and they resected partially, but they didn't do anything for 4 months. I will not say that they didn't do anything, but I will admit the mistake at this point, and this is an unforgivable mistake. I'm so sorry to tell you that. And then embassy can feel for you like this. After the surrogate or the patient, the news, then I will go to the other news that
Yeah,
and I'm so sorry that
it is spread again.
it is spread. I don't know how to put this, I will think, but again, you have to give him the other news.
Yeah, it
Is
will
this
be warning
right
shot
or
also
not?
again. And yes, of
Yeah,
course. But the
warning
good
shot
thing,
or 2 or 3
but the good
warning
thing,
shots. Yeah,
but you can
yeah,
follow it with a good thing that if we this cancer, we can cure it, as Dr. Dalia said, we can
yeah,
remove it.
and you
Yes,
know what? The explanation of Dr. Tanvir, I liked it too much because he, in order to convince the patient, he told him we want to prevent it from spread to other parts of the body. In
exactly.
order
Yes,
to cut this spread, we need to remove
yes,
this lesion.
yes, exactly.
Actually, this is difficult, very difficult, very bad mistake.
Yeah, that's why you have to be sympathetic to all the scenario. Because you have mistake and you have bad news. It's two tasks here: breaking bad news and the medical error and the amputation itself as a breaking bad news. So it's a cancer, breaking bad news,
And maybe
amputation, breaking bad
angry
news.
patient as well.
Exactly. And he will ask
So
you
you
for
fall in
compensation.
one.
Yes, he is,
Yes.
he is, he, yes,
Daria, especially if left-handed pianist.
yes. If he asks you, by the way, you can refer him to the legal advisor. They will deal with him and they can continue the process. And
This
he
is
can
about
also
the
ask
compensation. Yeah, if he asks,
compensation. He can
do
ask
I
about the
have
complaint.
compensation? Yeah,
Yeah,
I will refer you. Yeah, you have.
exactly.
I will not
So
say you have the right
issue.
or you will get compensation or anything. I will
don't
not
raise
give him
it.
any
No, no,
right.
unless he
Yeah,
raise it. Yeah.
yeah.
Okay.
Okay, clear now?
Yeah.
Yeah, regarding compensation, let's start the comment from downward up. We refer to the pulse. They will guide for compensation. No, the compensation due to or during or through the legal advisor. But for the complaint, pulse office. Okay, Dr. Tanvir. Also should clear about the right for compensation and that we will give the patient report explaining what happened. No, don't go through all these details. Just tell him uh, if he raised the point, we will refer you to the legal advisor to process for this as a compensation. For the error, we can guide you to the office called Patient Advice Liaison Services. Okay, let's go forward more to the comment. Admit, apologize. Yes, of course. Sometime can be treated. It's a rare possibility to be cured, and it's not the role of stage 4. Yeah, Dr. Dali, I think this is what you mentioned previously, Dr. Dali, right? Instead, you might reflect the outcome of this down, staging simple language to the patient. So be careful as me. Yeah, so again, don't say possibility. It was clear this is metastasis. The scenario is breaking bad news plus reflection advance some highlights of procedure. I don't think appropriate to ask about driving for which scenario, the previous or this scenario? The previous scenario, back pain. No need at all in both scenarios. Driving is not, it's not a question in both scenarios. I think, by the way, if you're in the communication, driving only with vision issue. If he has vision problem or epilepsy or hypoglycemia and awareness.
Assalamu
These three
alaikum.
scenarios. Alaikum assalam wa rahmatullahi wa barakatuh.
But doctor, he is losing his arm. I think it's difficult to drive sometimes, or most of the time.
Okay, but I think it is not the time to ask about it. Even he is losing his hand. You will shock him with the driving also. He has 3 shocks now. The cancer, the spreading, the amputation. I don't think it's the matter to ask about driving here. But yeah, it's a good idea if you said about losing his hand. Okay, but
Yeah,
for me, I will not go through it.
I think we should.
Especially if you don't know if he's left-handed or right-handed. I guess some people can drive with one hand, right? There is
Yeah,
handicapping, a lot of handicapped people and who can drive with one hand or with the paralyzed
yes,
hand.
yes, but about his job and his driving, I think
If he is driver, of course you have to. If this is his job and he's dependent on this job, you got it. But if he's driving his cars, I don't think it's a time to ask about it. But if he told you now I am driver or taxi driver, I work with my hand, this is a big issue and it's a big dilemma. You have to do a lot of things, occupational therapist and compensation and blah 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 blah. But if just driving his car and the job is different, so you can refer him to the occupational therapist. They can deal with that. Okay, clear? Thank you, Dr. Muhammad, for the concern. It's nice comment also. A nice point for this scenario. But for the back pain, I don't think. So this one was for the hand scenario, right? Okay, let's continue our comments. We
Assalamu
are,
alaikum.
wa alaikum assalam wa rahmatullahi wa barakatuh. Yeah,
Doctor,
Dr. Ibrahim.
about spine metastasis, usually they ask the patient to stay flat and don't drive, don't move sometimes until they do start management, I think. Yes?
I don't think it's also the time to talk about driving with both scenarios. For me, I don't think you can reach to this level. You have a lot of things to explain, but if you finish all the tasks and you can touch this point, yes, you can do it. If you feel it can harm him or it might affect his driving in both scenarios. But better to ask him if you're driving and do you think it will help, it will harm your driving? If he said yes, you can address it. Of course, after finishing all the concerns and all tasks. Clear, Dr. Ibrahim?
Can I comment on this question, please?
Yes, Dr. Dalia. Go ahead.
Okay, and for this in particular, usually when there is metastasis or any lesion in the back, usually the neurosurgeon will assess the patient, okay, and then after that he could say he needs to be flat or he needs to do
Mhm,
some, because they need to be, if it's something could be
mhm,
harmful for him and
mhm,
could do serious complication or not. So if it's not mentioned here, we
mhm.
prefer not to dig deep
Yes,
on that.
yes.
So it's not written here. It's need to be like some. It's exceptional. This is exceptional thing that unless it's written, um, so it's better to avoid that,
Yes.
because what shall you say? Just if the patient said to you, ah, yes, I'm driving. Do you think I need to stop driving? This is a very difficult concern for you, because you need to do a referral to the
Mhm.
neurosurgeon. It might not be in need now. You could,
Yes.
so you will put
And it
yourself
might also affect the clinical judgment. Why you stop his driving? They might say,
to
yeah,
stop
why you stop his
driving.
driving?
Yeah, it's sometimes it's from the CT, the MRI. They could say it needs to be assessed by the neurosurgeon. Okay, then to decide whether it's need to be flat or not, or any
Mhm.
just any
Yes.
such things, yeah, to be discussed. But it's better to, if it's not written here, I can say, yeah,
I agree
I
with you, Dr. Dalia. Yes, I agree with you.
thanks.
Thank you, Dr. Dalia, again. Okay, there was also a question for lasting power of attorney and advanced directive for the previous scenario for the cancer and metastasis and so on. You are sitting with the sister, and also this is the first time to explain the cancer and the metastasis. I believe it's also not the time to ask. The same for any scenario for as the first meeting, and still you don't know the cure or not, the plan, the nature of the cancer. You don't know all of these things, so it's better not to to think or to ask about particularly these points, the advanced directive and lasting power of attorney. By the way, in the exam wise, the surrogate will drive the scenario and he will not give you time to think what to do. You can address his all concern properly and you will get the full mark. If you have time at the end, you can select some point to ask about. So social is much important than the lasting power of attorney and the advanced directive. In the other side, if you have patient written the scenario clearly, end of life care, it's a must to ask about advanced directive and lasting power of attorney. So these are the difference between two scenarios. You have to do here, and the other scenario, it's not necessarily to ask about. Okay. Palliative, end of life, you have to ask about lasting power of attorney. Any other question? I guess we covered the most
Yeah, just
important
an addition,
comments. Yes.
Dr.
Yeah,
Bassem,
doctor.
I don't
Yeah,
know,
yeah.
but usually with
Mhm.
patients with amputation, the plan as a part of reassurance that we have a plan for the management, there is a rehabilitation program,
Yes.
okay, after the
Perfect.
amputation.
Perfect.
So,
Yes.
and there is team of physiotherapists and occupational therapists, so they could they will tailor the need according to your need, tailors everything for you
Yes. Yes.
needs. And if there is also possibility of prosthetic limb, this is a kind of reassurance, okay, and how to use it, and all these details you could know if you accept to do that operation.
Yeah. So this is a hidden agenda, the prosthetic limb and the
Yes.
compensation. It will
Yeah,
be
yeah,
hidden
yes.
in both sides. You
Yeah,
have to
and
know it.
the rehabilitation program is very important.
Rehabilitation, yes, very important. Yes.
Okay, will be two
This
and
regards
yeah, a follow up and rehabilitation program. Okay.
perfect. Yes. Thank you, Dr. Dalia, for this point. I think Dr. Ibrahim add here on the last thing, malignant melanoma of this size has very poor prognosis. You don't know the size, by the way. Don't think more about the clinical judgment. What's written, follow exactly what's written in the scenario. Don't add details. It might be deep, it might be larger. It's if not written, don't think about it and don't raise it. Okay, don't tell the patient there is good aspect, just why try to contain the disease. Yeah, so what's written, you have to stick to that task. Don't think about the depth, or it might be deeper, or it might be. So the end decision, it will be removal of the cancer with the hand. Okay? Don't try to make more details or to explain by more details. Maybe some details you will add, it will be like inventing. Who told you this, the depth of the cancer? And it might harm also the clinical judgment. So don't talk about something not written. Just stick to the scenario and the task. If say they said removal, so we will remove. Regardless the type or regardless the nature, the depth. Is it clear now?
Dr. Basu,
Yes, Dr. Az.
can we talk about the compensation in this scenario?
Which one? That's the first or the second scenario?
Second.
Yeah, we talk about it. If it was raised by the surrogate, we will refer him to the legal advisor. We talk about it.
Okay.
You got it?
Yeah. Yeah, Dr. Tanvir, it's better to just if it's raised concern. Otherwise, you don't need
Yeah,
to
yeah.
mention that.
If it was raised by the surrogate, Dr. Azhar.
Oh,
Okay. Any
and
other
during
concern?
Ramadan, what will be the timing?
Sorry?
Tomorrow, during
Yeah,
Ramadan.
perfect. I was about to talk about that. If all concern finish about these scenarios, so we'll talk about Ramadan timing. Actually, this is the last session before Ramadan. Yes, tomorrow off, of course, because of Friday, and
Yes.
mostly Ramadan will be on Saturday as first day. So, for the sake of prayer, Taraweeh and so on, I might make it 11:30. I will see how is the time after Taraweeh and how is suitable for me. if I can start 11:30, it will be okay for, I think, for all of you, right?
Okay.
So 11:30, all people, I think, will finish Salah Tarawih, and we can start the meeting straightforward. Is it okay?
Yes.
Okay, so inshallah, we'll start on Saturday. The time will be 11:30. Ramadan Kareem for all of you. May Allah accept our thoughts and prayers.
Ameen.
Please pray for all of us, and hopefully, inshallah, we'll pass this exam and we'll celebrate soon, all of us.
Where we will celebrate.
Inshallah. Okay, Ramadan Kareem. Kull aam wa antum bikhair.
Okay.
Thank you, everyone. Thank you, Dr. Dalia, for your comment, Dr. Tanvir, Dr. Dalia, for practicing, Dr. Azhar, everyone. Ramadan Kareem. Enjoy your weekend. See you, inshallah, on Saturday. Good luck and good night. Assalamu alaikum wa rahmatullahi wa barakatuh. Ramadan Kareem to all of you. Thank you.